I'm busy talking. My next guest has been on with me before. This is really cool. This is something people need. I now have with me Suzanne Webb, and she's the founder and CEO of Exclusive Surgeries Network. Welcome back to the show.
Thank you.
Tell everybody what you have created for everyone out there.
What we've created is the best place for people to go to find the top surgeon, as well as the safest environment, which is an ambulatory surgery center that's closest to them.
Okay, so people that go on, there's no fee, okay, and there's so that they can go on and they can actually find the top doctor in a surgery that they need, correct?
Correct.
For instance, like what kind?
Let's say they have rotator cuff. They have a problem with the rotator cuff. They're not sure. They're going to be able to go to the top surgeon. They're going to walk them through the whole process with it. So, or knee, ortho, podiatry, spine, neurology, basically anything you can think of, as long as you don't need a hospital stay for it, because it's all outpatient. So they go in, have the surgery, and they leave.
Okay, so who should use your website? Who is the people that, is it anybody that needs any kind of surgery or a certain type of surgery or what?
The best people are those that are healthy. They just need to have something fixed. So if they have carpal tunnel in their hands, they're healthy other than that. So we're looking for people that are working, that have a job, people that are in good health. If you've got, more chronic things, then you should go to a hospital. But for most of the surgeries, you can go to an ASC.
So what you're doing really is you're doing the homework for everybody.
Doing the homework and also providing them with a zero infection place of surgery.
Okay.
So that's the biggest thing. Hospitals aren't at a zero. Most ASCs are at a zero infection rate because no one stays there. At the end of the day, everything's cleaned up. People go home, and there aren't sick people that go to an ASC because they're all healthy when they have surgery.
How important is that?
That's the critical thing that keeps you alive.
Let's talk about that because, we didn't that much the last time, but it is huge. I have now, myself, I had a staph infection from going, it was years and years and years ago. It happened. It can happen to anybody.
Correct. And then it's up to how you actually can heal. There's a lot of people that don't make it through. They get an infection. That actually kills them. Some people get an infection and they can work through it, but it takes a lot more time. So if you're a working individual and you go to a hospital and get an infection, they're going to keep you for a week. If you only get a week of sick pay or a week of vacation, it's gone. You're not taking the kids to Disneyland. You're not doing anything fun because you used up all your vacation and personal time because you were at the hospital. So we really want to go up to those employees that need to get back to work, quickly and safely.
Right. Now, so anybody can go on and they can just look up what's the process of how they do it?
They just go to esurgeries.com and they put in whatever they're looking for, the diagnosis there or whatever body part hurts them, and then they'll come up with a list of surgeons that are in the area.
So it is esurgeries with an S.com, and you can go up there, you can find out who would be the best surgeon for the type of surgery that you might need. Will there be more than one? Will be there 5? I only want 3, that's it, I want to know, and then decide that's it.
That's what we're looking at. So right now, if you're out there and you're a surgeon and you know you're the best in your field and you do work at an ASC or your surgeries are qualified to be at an ASC, you can go right online and apply. So what we're doing is they apply, then we take them through a vetting process to make sure they're the best. We check out their credentials, we do an extensive background check on them, and then we add them to our site.
Any kind of any kind of surgeon?
Yeah, any kind of surgeon that works at an ASC. So
okay.
They don't do a lot of cardiology and things like that. So the surgeons know what they can do.
So now, of those people, do they go online? Can they look there first and then they would get connected with you, or how does that work?
We're not connected at all. They're connecting right to the doctor's office. We're not keeping any personal history. They don't need to log in and give me their name or anything. They just log in, look for what they want, contact the doctor's office.
So check them out. It is esurgeries.com. And, all right, so you explained to our listeners a little bit about these ASC facilities. Are they, when you said vetted, and I don't even know what that means, what does that mean?
Vetting is when you do the credentialing process. So you go through, so for an ASC, I'd look at, make sure that they're state licensed, if they have a Medicare, that their certification is up to date, that they're doing everything clinically they're supposed to do. We're also going to make sure that they don't have an infection rate and that they've kept it as low as possible and that they're running a great business. So I want ones that have been in business for more than 5 years, know how to handle patients, know how to have great results.
Again, that's esurgeries with an S.com. It's a win-win. Okay, so anybody that's listening out there that's having any type of surgery, you go up there, and like I said before, it's sort of like an Angie's List for surgeons, but more so than that. I mean, obviously you've done, your extensive homework to know really that these people, because, I mean, they're doing surgery. It's not like they're coming in doing a handiwork,
Right, and that's the thing right now, people don't know that when they go to the hospital or their insurance company points them to a surgeon, that doesn't mean that that surgeon is the best or that they're even board certified or that they're even good at what they do. And so that's why we really created the network, was I want people to be educated. They know they do all this homework on a restaurant for dinner or on a movie, but when someone says, hey, you need surgery, hey, go see this doc. No, do your homework, go to the very best person. They all cost the same. I mean, most of the surgeons all cost the same. ASCs are 50% cheaper than hospitals, so it's a great bargain to go there, and you're going to walk away safe.
And and so you'll be healthy. But more than that, you will truly find out if the surgeon that you are going to have working on you is one that you really want to do that for you. Anybody can recommend somebody, but you know what? You have to connect with your surgeon. I would want to.
Right, and so all of ours is choice. We're not referring you to anybody. We're going to give you a list of, let's say for our spine surgeons, we're going to have 10. You can look at them. We have a video that they've actually put together, so you can listen to them talk. You can get a feel for what they're like, and then make a decision. You choose where you want to go.
What are the requirements, though, for a surgeon that's listening right now that would like to, get involved with this? What are their requirements?
What they would have to do is just go online. We have a Get Listed, so they hit Get Listed, say they're a surgeon. They're going to go through and give us their preliminary information. So definitely if you're not board certified, you won't make the cut. So we want you to be board certified, to be in business for more than 5 years, to not have any malpractice claims, to not have killed anybody in your practice.
You better not have.
So all the basic things that you would look for. So it's kind of the list that, since I've been in healthcare for a long time, it's the list that we would give our family members for who they should use. So I go to like primary care doctors or concierge doctors and say, who do you recommend for your family? If this was your mom needing surgery, who would you refer them to? It's a different list than what they give everyone else.
Sure. I mean, here's another thing, too. If you're listening to this and you are work for somebody who is a surgeon, and you think that they would be qualified for this, it's a win-win situation for them, especially. So their website is esurgeries, that's plural, .com. Now, for the business owners, the HR departments and everything, do you want them to get involved with you too?
Absolutely. What we have for the employers, we actually have a physician-run wellness program. So we're the only ones in the country that actually are using physicians and medical professionals to run wellness programs. So we're doing more or less a video library that we can give to employers so that they can kind of give that to their staff and let them see what doctors are saying about wellness, not what they're offering their company.
So if there's a company out there that would like to get this with you, how do you merge with each other?
Same thing, you go on to esurgeries.com, go to Get Listed and put in the employer name, and we'll have someone in our office follow up.
So it's pretty simple. It sounds like it's a win-win. There's really no cost to anybody, really, and as far as I know, correct?
Oh, no, that's correct. We're doing it. It's all, the doctors pay for it. They have subscription-based, and so there isn't a referral fee. No one gets paid a referral fee. This is absolutely your choosing. If they're elected or if they're qualified to be part of it, then they pay a subscription fee monthly, and that's it. So we don't do revenue sharing. We don't take a percentage. It's a flat amount of money.
Again, that is esurgeries.com, and again, the different types of surgeons. I know that you have the carpal tunnel, and I know that you have the knees, and I don't remember what the other. I know you do eye.
Oh yeah, definitely. Anything ENT. So you're talking about your ears, nose, and throat. I look at almost everything. So right now it's October is breast cancer awareness, and so people that are going to have their breast redone normally go to reconstruction or plastic surgery. So everything can be done by a plastic surgeon is part of it as well.
Wow, so there's a lot of different things up there. It is a win-win situation for everyone. So even if you're just looking to get some surgery done and you want to make sure that this is the right guy for you, they've done your homework for you. So it's esurgeries.com, and if you're a surgeon out there listening to this, again, tell them what the requirements are.
To be board certified, to be in business for more than 5 years, not have any malpractice claims right now, but we want you. We want the best surgeons.
The best surgeons of what they're looking for. Again, it's esurgeries.com. What are some of your final words for today?
Just for today, I'd like anyone that works for a company that doesn't have a physician-run wellness program to just go online and tell us. We're not charging for the physician library right now, so it's something your employer can get immediately. We also will go in and explain to you how your benefits work, so they can understand their deductible, their copay, co-insurance, and the best way to use their medical dollars.
Okay, so that's anybody who's in HR. And again, this video library that you're giving to them, how extensive is it? I mean, there's got to be a lot to it.
It's going to be huge. I'm going to have about 10 videos that are just from concierge doctors talking about wellness, as well as other services that people don't think of. And then all of the surgeons are doing ones that people understand what surgery really is.
You know what, we really have had to change things a lot in the last few years when it comes to our health, and especially when it comes to the businesses that have, you know, these HRs and stuff like that that need programs. Again, it's esurgeries.com.